I'm from Charleston, South Carolina, and I chose medicine because I had a mentor as a family physician. He was considered a community leader, Dr. Wanamaker, and now that he's passed on, they've actually have a park named after him in the North Charleston area. But he was such a strong role model for a caring family physician. I've been in practice in family medicine 21 years, and then a number of years in the medical field as a doctor of pharmacy, faculty member at Creighton University, and running surgical research, doing surgical pharmacology, teaching. So I accelerated through college with 2 years, 2 summers, went right into pharmacy school, and then accelerated another year there, going directly to the doctor of pharmacy program. So at that time in my life, I was a little bit in a hurry to get done my academics, and actually wanted to go into family medicine, but there was one hurdle that I just couldn't get over, so I ended up steering into hospital-based pharmacy pharmacology, and from there went on and did a special residency in surgical pharmacology at University of Kentucky. And after then working for nearly a decade in running surgical research, teaching medical students, I re-entered medical school, and when it was time to choose a specialty in medicine, I came back to family medicine. I think family medicine has a culture and a way of delivering medical care that's different than really any other subspecialty in medicine. This was highlighted by Dr. Barbara Starfield with a lot of research showing that if you could put family physicians into an area, your results were better, and ironically, the more subspecialists you had penetrated into a county, the higher the cost and the less quality. So I like family medicine because it deals with the whole person, body, mind, and spirit. And it's the only specialty in medicine that really treats the person in context to their triune being, and as well as their family and their psychosocial environment. When I went back to medical school, I didn't think it would be so, but I ended up going as a lowly medical student into a university which I had been tenured and promoted on the medical faculty. So I had to make that switch at the same university in Creighton. Then went to Oklahoma for my family medicine training. I actually chose to go to a Christian-based program, which I wanted to learn how to integrate people's spiritual needs with their psychological and psychiatric and physical needs. And I think the program really helped me do that and feel like that was just part of being a Christian physician. As a pharmacist and a pharmacy trainee, and then later as a clinical pharmacist, I really looked up to medicine. I thought it was the ultimate healthcare profession. I thought it was a great profession, had great roots. Whereas someone said, as a pharmacist it will be a career, but as a physician it will be a lifestyle. And so the emphasis there was, at that time, was really on an unintruded doctor-patient relationship, one where the doctor and the patient made the decisions and was unencumbered, not so many outside forces to bear on that relationship. I've watched that whole process erode from a very patient-first, personal relationship with the patient, doctor-patient relationship, to having governmental and insurance forces, regulations. I feel like it's been overregulated, underfunded. These forces have caused the physician to have to spend a lot of time doing non-patient care related activities, documentation, meeting certain guidelines and standards. And unfortunately, these are all devised by many people who have never practiced medicine or no longer practice medicine, but have, in a sense, sort of thought this up as being a way to improve medicine. And what it's done is it is interfered with that precious doctor-patient relationship, and instead caused the country to move in a way of delivering health care in a population-based way. In other words, much like the government runs things in a very non-personal way, trying to meet the needs, but not necessarily considering the individual needs. January of 2012, Bailey Family Medical Care became a concierge or membership style practice, and all of a sudden we saw a much more collegial relationship with the patient, helping the patient and partnering with the patient for their optimal health. And one of our mottos or taglines is, we want our patients to be healthy and happy. And I think that is the result. We have healthier, happier patients. The data is well documented in the literature that this style of practice produces the kind of old style Marcus Welby type care with the newest technology, which ultimately patients get all their questions answered. They're able to reach their doctor out of office. In other words, we sort of meet the patient wherever they are and where they go. My background started in critical care, nutritional support. I saw where nutrition could bring folks almost back from the dead and be miraculous. And we said, if we could have a practice where we could do medicine our way, we would integrate nutritional supplements of high quality along with pharmaceuticals. So nutraceuticals plus pharmaceuticals, I think, provides the best treatment courses for patients. And this is an area in functional medicine, and many of our paraphysician providers, if you will, that lean heavily on this, but your physicians, unfortunately, have very little or any training in this area. So this has sort of been a unique area to myself and our practice. Those that have chosen to join and be part of our concierge membership-based practice are much happier because they are seen in a more timely fashion. Their wait time is minimized. Their prescriptions are filled timely. Their needs are taken care of. We often assist them with referrals to subspecialists, making those appointments for them. Many times they can get in same day or next day, even with the subspecialist, with our help. So this makes the patient feel like that they're secure, that their health needs are being addressed very timely. And I think, again, there's no argument that the patient outcomes are much better. I would say to a patient who's considering joining a membership or concierge practice that it would be the best financial decision they could ever make in their life, because we know that loss of health is the #1 reason for personal bankruptcy, and therefore that alone would be a very wise financial decision. I would just add that I think that we've been very blessed to retain our core staff for 12 years so that the patient, when they're dealing with one of my other team members, they feel the same care that they feel with me, and that we've always thought that there may be someone that does some aspect of what we do possibly better, but there probably wouldn't be anyone to provide the broadness of care that we do. I know that you were interested in what we're doing with the BALE DONEEN methodology of heart attack and stroke prevention. This methodology has been available for some time. Dr. BALE and DONEEN teach this multiple times a year, and about a year ago they put their book on the market so that the public could become aware that there was a methodology to quickly discover plaque disease, vascular inflammation, stabilize it, and reverse it so that people would not have heart attacks and strokes. And that book is called Beat the Heart Attack Gene. And this is a dynamic methodology that I continue to stay involved with. And a unique story that I have is, at the time, several years ago, a gentleman 49 years of age. I had just done a membership appreciation right around the week before Christmas. And the next day, he pinged me on social media and asked me if I could recommend a cardiologist. He was not my patient at the time. I basically told him that wrong answer, Alex, for 200. We need to talk. And he called me at the end of the day on Thursday, and what he was describing, he was very athletic, but what he was describing what sounded like unstable angina. When he would push himself to his extreme workouts, he would begin to develop chest pain and have to stop. I strongly recommended he go to the emergency room, and that I would be happy to take him on as a patient. He accepted that part, but he didn't want to go to the emergency room. In fact, he refused. And I said, if you're not going to the emergency room, I want to see you at 7:30 the next day in my office, given we hadn't really even seen each other, just been a verbal agreement by phone that he would establish with me as a new patient. In being proactive, I had Kathy on my staff make him a direct order for an echocardiogram followed by a nuclear stress test the following Monday, given this was the Monday before Christmas. All of this would not have been possible outside of this practice style of concierge medicine. Unfortunately, he did not make it to 7:30, but had a massive heart attack that night. I had told him to take an aspirin. His wife was traveling in her work, and he drove himself in the middle of the night to our local emergency room, and of course the race was on. He had very unstable plaque, which the angina was hinting at, and that plaque had ruptured and blocked his right coronary. He was taken to the cath lab and immediately angioplastied so that flow would be restored to that area. And when they evaluated him in the cath lab, his coronaries were full of, at 49 years of age, of plaque disease. So as I was seeing patients that day, I was able to get on the phone with the patient, with his father, with his local pastor, spoke with the surgeon 3 times, twice before the surgery and once after. And he had to actually go for a 4-vessel quad bypass rescue to save his life. I gathered up Johanna at the end of the day, and we grabbed some flowers and we went down to visit him and basically saw him immediately post-operatively. And I assured him that it would be my promise that he would never be back on a cath table again. 3 weeks later, he was officially enrolled into our BALE DONEEN program. And I can say with a lot of joy that 2.5 years since the event, he's been symptom-free, and all of his lab work has continued to improve. The one that's most impressive is a test called the beta natriuretic peptide, which is a very sensitive test to the quality of the heart muscle. After this massive heart attack, that number was around 1,600, and every time we've checked it, it's come down. And this last time, it was actually down to 200. And when it gets under 125, it will be normal. So we're fully expecting that number to be normal. All of his inflammation is down and normal. His cholesterol is down. He has been a very good patient to follow what I've recommended and also to change his diet, but he's back in full activity. In fact, as I understand at this very time, he's halfway around the world doing a mission trip. So that's a very satisfying, had that not happened the way it did, it's possible he may not have made it. And I think it would have not only been, he would not have fulfilled all the call on his life, but he is beloved by hundreds of people, very public figure. So that was very satisfying again.